Are you in pain?
Yes.
So can you tell me a little bit about your story and your personal cancer story and how you've been in pain?
Well, there's two stories. I'm in pain. I'm kind of like a multiple grenade attack. I was in a car accident when I was young, and my foot was cut off at the ankle and sewn back on.
Wow.
In emergency surgery, and I was told I would never walk again. So over the years, I have increasing traumatic osteoarthritis in my ankle and throws my whole spinal thing off. Because of inflammatory breast cancer, I had to have a total radical mastectomy and all my lymph nodes removed. The surgery also cut my brachial plexus nerve to the extent that neurologists said that the only way I would get out of pain was by dissolving, basically destroying the nerve.
Wow.
But that would make me incapable of using my right hand, and you know how I am about the computer, so that wasn't going to happen. So those are a couple of the major pain things. I also have oral pain because 5 years of chemotherapy destroyed my dental work. So I've been fighting to keep. I had implants which came out, and as most people do, there's jaw destruction from the chemotherapy.
So how long has your cancer journey been going on?
Since 2004.
Wow.
That's when I was diagnosed. And I was diagnosed, and basically at the time of diagnosis, the odds were 30% that I would survive 18 months.
Wow. And obviously you survived much longer than that.
Yeah.
So what is it that you think got you through that process and through the pain?
I don't have a single answer because I use so many different modalities, and ultimately, as you know, I'm an interfaith minister. I work with indigenous people all over the world, and I think part of the cure was that I had so many people praying for me that Creator just went, enough, okay, we won't take her now. I wasn't done yet, you know, and I did everything. I did complementary healing, I did traditional healing, I had a lot of people who did ceremony for me, and I tried every type of chemotherapy that came down the pike, and in the process of that, I also, because of, I have had to have so much skin removed because inflammatory goes through the skin, that when I had, and they give you extreme radiation, it's about double dosage for regular breast cancer. I had to go on, I had such severe burns that I had to go on Dilaudid, which is a very heavy pain pill. And as a cancer patient, they give you a lot of pain pills. So I realized that the Dilaudid after a while, it's interesting, when I was in excruciating agony, Dilaudid didn't bother me at all. It was fine. It didn't affect me. It started to really affect my worldview, so I realized I had to step down, so I went from Dilaudid to the different codeines. I don't do that well with codeines because it cuts me off from my spiritual awareness. I guess that's the best way to describe it. That I have trouble accessing the crown chakra, and I had some very dark times with the pain meds.
I'm sure. Because Dilaudid particularly is a very strong opiate, right?
Yeah, they all are.
Yeah.
I think somebody said Dilaudid is 100 times stronger than heroin.
Wow.
But I could, you know, as I said, when it was appropriate, didn't bother me, but as time went on, when I knew I had to shift was when it started to mess me up. So I had to step down. But because I had such bad pain, both in my leg, because I was also taking aromatase inhibitors, which makes the pain from arthritis way worse. So there were days I couldn't walk. So the whole journey of figuring out what to do with pain has been and still is a constant process.
I'm sure.
You know, finding out what helps nutritionally for me, what supplements help, what I need to do for my body, what messes me up. Like, for instance, a radiation oncologist told me cold wind is, you know, really bad. And she's absolutely right. I try to avoid cold wind. But it's interesting because it's almost like a 5 directions, you know, Chinese medicine understanding of effects. Sitting is hard for me. I don't sit for long periods of time because the pressure that it causes in my chest becomes very, very uncomfortable. I just find that dealing with pain there's no one answer that I think, and there's no one answer for me. I don't have judgment on the way anybody else deals with pain. I know that I've become very aware, particularly with my own cancer journey, about quality of life. So I think anything that gives you a decent quality of life is a good thing. And that's different for different people.
Sure. So in your daily life now, how would you say that your pain affects you?
It depends on the day. It totally depends on the day. Some days, because of my leg, I can't walk very much. So, for instance, I have to get a dog walking service so my dog gets enough exercise because I can't go out and walk her adequately. Because of the arm problem, I no longer can drive long distances because keeping my arm up like this, after a while I go into severe spasms and then I can't drive. So it's limited my physical ability to do certain things.
Okay.
Well, I try to keep positive. It can get you down. I mean, there are times when the pain gets really, really bad, and it's crushing. It's crushing because you feel like, why? You know, pain is one of the scariest aspects of cancer, and living in pain limits your access to your creativity. It's very hard to create when you're in pain. It limits your ability to go out and enjoy life. You know, so there are times where it gets a little dark.
And with cancer, it's complicated too because it's not usually the disease itself that gives you the pain, but the treatment for it, right?
Not always, not always. I mean, people with, for instance, bone metastasis can have, and the different metastasis can have very severe pain from the disease itself. So, you know, that's not, and sometimes the treatment, the surgeries or, you know, the radiation will cause pain. Usually the treatment pain, except for the surgeries, is self-limiting. But in my case, it was not.
Is that because, was it an error on their part that they hit that nerve?
I don't know. I mean, I had one of the best surgeons in the world. I think the cancer was just wrapped up around the nerve. And they had to hit the nerve also with radiation to make sure that I didn't suffer by having the cancer grow in the nerves. That would have been really horrible. Oh. So, you know, it was a multiple, I don't have an answer. You know, karma, who knows?
What happened, happened.
Yeah, what happened, happened. I mean, you can't look and say, well, why did it happen? You can only look and say, how do I work with what this is?
So would you say it's a matter of really accepting the pain and learning to deal with it on a daily basis?
Yes, absolutely. Acceptance is a really important thing. Learning that when I was bringing myself down from the heaviest pain meds, I had to keep doing, and I still do, a mantra about pain is just sensation. It's just nerve awareness. You know, it's the body's attempt to tell you something's going on. If we try to fight pain, it becomes worse because we tense up around it. It becomes more consuming. If we can allow it to be and just be present, it tends to diminish. That's why at some issues, even talking to you about pain, because focusing on it makes it worse.
Right. So on a little bit of a different track then, so you don't focus on it as much. I know you do a lot of work with other cancer patients and with cancer pain in particular, and I know you have a lot of specific thoughts on it, and I would be really curious to hear what you have to say.
Well, again, it's part of my journey of learning, because everybody I work with teaches me something, that there is no one answer to dealing with pain and dealing with the ravages of cancer. And most people dealing with the disease, again, it's one of the things that everybody with cancer is most afraid of, it is the extreme suffering. So while we have issues with treating chronic pain in this country and not monitoring or dealing with it well enough, and I don't know if, you know, our whole medical system, our whole insurance system is not set up to make that happen very well. But particularly with cancer pain, people need to have what they need to be out of pain and not to be in fear of dying in agony. And I've seen too many times where pain medication was withheld from somebody with really severe pain and terminal cancer because they were afraid of getting them addicted, and that's insane. On the other hand, because I was considered terminal, I was given a lot of pain meds, so I had to bring myself down from that. And in a sense, fortunately or unfortunately, most of the medical, pharmaceutical remedies didn't help me at all.
So did you go through really bad withdrawal?
No. No, I mean, I stepped myself down, but
Right.
Nothing, in other words, they tried a variety of different medications.
Okay.
We went through the Neurotins and the Lyricas and you know, nothing, nerve pain, nothing really touches.
Did you find other alternatives that helped with the nerve pain more?
I did. I actually had a wonderful physical therapist who turned me on to acetyl L-carnitine, which is a supplement which helps with nerve pain. There are a couple of other supplements that other people turned me on to help with the arthritis pain and the different areas. So it makes it more manageable. I'm very aware of when I get sloppy with the supplements, I pay. Supplements, meditation. I mean, there's a variety of things that I found have helped. Keeping myself particular temperature is also an interesting one. If you get too cold or too hot, things begin to happen. Body work, energy work. Energy work I find really, really important. I also did a lot of work with the pain body concept. You know, why we hold pain and trying to release that. I mean, I'm aware of if I hold the pain, if I get like this, you know, if my body gets uptight or compressed, or the pain level's going to go nuts. Mm-hmm. And if I take some time to just, and sometimes I need help, I need body work, I need energy work, I need meditation, I can make it lessen. It's never going to go away, but it's going to lessen.
Do you think that do you use the energy work in a combination on the physical pain and on the mental kind of acceptance and tightening around pain?
In a question, I don't quite get that one.
Sorry, do you use energy work both to ease the actual physical manifestation of pain and to ease your mindset about the pain?
I don't think there's a difference. I mean, one of the things that I studied in my master's degree was neurology.
Mm-hmm.
And neural firings, and particularly what is pain, what do nerve synapses tell us, how do we read them? I think it's a complex issue that we don't know a whole lot about. How do we reinforce particular pathways? How can we unreinforce those pathways from happening? And I think that's a major area of pain that we haven't looked at yet. So I think there's a lot of work that has not been done. I mean, our understanding of pain isn't good. We understand pain as a symptom of, the good thing about pain is it's a symptom of something's wrong, pay attention. But chronic pain and how to deal with it is something we really haven't done. And again, we're just beginning to explore the neurology of the brain. Deepak's been doing some work on it with some other people. But we don't understand enough about how neural systems work. We've just begun. And pain is a offshoot of neural firing. So it becomes, there's a lot we don't know. And sadly, I think that the quick remedies of the codeines and the pain relievers, although they're fabulous for acute situations, more people used to die of pain than anything else before we had them. We know that they're not as effective and they lose effectiveness with chronic conditions. And we haven't yet explored what are some of the modalities we could use for chronic pain, which is not symbolizing an acute situation that needs to be dealt with.
Right, so the switch from the treatments for acute pain, which can work really well, to finding a similar system that works for chronic pain.
Right. And we don't have, and again, I don't know what the cause of that problem is. I think it has to do with the pharmaceutical companies, the insurance companies. And I have nothing against pharmaceuticals. I mean, before this interview, I took a couple of Advil and, so I could sit up. And I think everything is worthwhile in its place. But again, everybody has to manage their own stuff. But again, even from what I know about the pain centers, there hasn't, we have a schism in what we deal with complementary medicine, what we deal with neurological research, and what we deal with medicine. And they haven't been put together yet. We do either or. Our idea of holistic is pretty fractured.
Mm-hmm. So what's your advice that you give people who are going to be entering cancer pain or who are experiencing cancer pain?
Well, I deal with a lot of modalities of pain, so it's not just cancer pain. I listen.
People need to talk.
I listen. I don't have a right solution if people are having issues. I try to help them deal with ways to step down or change things or deal with stuff if they're having issues. If they're managing and their life is okay, guess what? It works. I know people who have to take, codeine every day of their lives. I listen. I don't have I'm not an expert on the situation. I'm just a person who's dealing with pain.
And what do you think, if there's one key thing that you've learned from your pain, what do you think it is?
Compassion.
Yeah.
Compassion, tolerance, patience. I would say those are the three things. You know, I'm a lot less, in dealing with my own journey and my own limitations, I'm a lot less judgmental than I used to be.
That's a big step.
Yeah. So that's what I've learned. I mean, everything, even, you know, even suffering teaches you stuff. And the issue of suffering is such a deep issue that it's been at the center of all the world religions. The question of suffering, the problem of suffering, what is suffering good for, what is suffering, how do we overcome, how do we deal with, how do we, you know, all the world religions, suffering in most of them, particularly in Christianity, Buddhism, are two of the main issues. And people haven't solved the problem in terms of looking at it with the greatest minds in history for many thousands of years, so I'm not going to. I think there are other ways of suffering as well. Pain is one way of suffering, but boy, it's an intense one.
I'm sure.
So yes and no, because pain is a form of suffering, but that's why I went off pain pills, because I was suffering more from the pain pills and being cut off from source than I was from the pain. So it's less suffering for me to accept some pain than be cut off from my spiritual source. I do have to rest more. I can't, you know, I am limited in my mobility. But I've switched my focus, you know, instead of organizing conferences, I do social media. You know, I had an extra surgery to get rid of a problem in my arm so I could use the computer. My surgeon thought I was absolutely crazy, but I was having problems, you know, using the computer, and so I had an additional surgery so I could use the computer because I said I wasn't going to live without it. So I make different choices. I have to rest more. I can't go into a place like I was invited down to be with the Guatemalan elders for 2012 and in the jungle, and I was like, my body's not going to do that. But it's all right. I found somebody younger to send. So my life has changed. I mean, I do have to rest. There are times where I will come home, and if I don't lie down, I'm going to be a screaming, angry mess of the world. There are medications that I do take. I have chosen to take a muscle relaxant to deal with some of the pain stuff because it doesn't mess up my other faculties. But I do know if I don't take care of myself, I'm a mess. I get a wheelchair to go through security now because I can't lift up the suitcase myself. I tried to. Here was one. I decided I was going to be a big shot coming home from Florida this last trip. I didn't need any help. I had checked my main bag. I'm fine. I'm alone. Pick up the suitcase onto the belt and go into spasm and fall on the floor. So I have security standing around me going, oh dear. And I'm going, no, I'm actually fine. I just need to breathe. I'll be fine. You don't need to call a doctor. But things like that happen. But I'm also not young anymore. You know, so you know, I've had to find other ways of, because I am limited by pain, what brings pleasure into my life? You have to balance pain and pleasure. So the flowers, the feng shui, or the noticing the small beauties of life. Appreciation is the balance to pain. Appreciation is the balance. And if I can do something that I haven't been able to do in a while, don't forget, I was in bed for 3 years, unable to move. And that wasn't the first time. I also have another thing because I was in bed for 6 months during a pregnancy and then had a cesarean. I'm telling you, I'm like somebody who walked into a grenade. But I watch people who walked into grenades and are, doing, learning how to be again. You understand what brings you joy, relationship. What are the things where you forget about pain? What makes you forget? And getting passionate about things or getting involved in things or, that to me is one of the challenges. And I see, that is a good question, Lily, because I see people who really stay stuck in their pain are people who stay stuck, that's where their attention is. They're paying attention to their pain. And if I had any advice to somebody is, if you know it's not caused by a life-threatening condition or, that you can do something about, then pay attention to something else. Pay attention to a flower or pay attention to a loved one or pay attention to a passion or pay attention to, because when you're paying attention to something else, you're not in pain anymore. For those few minutes, you're transcending the limitations of your body and you're not in pain. You forget about being in pain. You forget about being the victim. And that is pretty awesome. And if you come back to pain, well, you come back to pain. We're all going to have pain. The Buddha said we all suffer, we all die. And that's the other thing. I remind myself every day that eventually I will die and I'll be out of pain. It just probably won't be today, so.
Better keep going while you're still alive.
It helps you to keep, it helps me to keep in mind that pain is finite. Life is finite, pain is finite. And I've learned to be, when I said compassion before, I've learned to be much gentler with myself. And that has been the biggest struggle. I can be compassionate to everybody else. I'm a people pleaser. I'm a world server. But compassion for myself, not so much. I'm learning about being compassionate to myself. I'm learning not to judge myself for what I can and cannot do. I'm learning not to judge myself for the fact that I have to go rest. I'm learning not to judge myself for saying, okay, I can do this, but I can't do that. Or I'm in pain, I'm cranky, and I better stay the hell away from people today. And self-compassion is not something that most of us are good at.